getting ready for mesothelioma surgery or helping a loved one prepare for it, you may have come across the term ERAS at some point in your conversation with medical staff. ERAS is an acronym that stands for Enhanced Recovery After Surgery. And if you haven't heard it yet, it's worth knowing about because it represents a genuinely different and more thoughtful approach to surgical care than what most of us picture when we imagine a major operation. ERAS isn't a drug and it isn't a single technique. It's a coordinated, evidence-based framework that structures the care you receive before, during, and after surgery. It actually starts weeks before the operation and continues through your recovery at home, all with the goal of reducing complications, getting you out of the hospital sooner, and helping you return to life faster and with less suffering. For patients facing the major thoracic surgeries involved in treating mesothelioma, understanding what ERAS involves and whether it's available at your center is a worthwhile and potentially important part of your preparation. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a doctor, and this is not medical advice. But today I want to explain what ERAS is, what it looks like at each stage of the surgical experience, and why the principles behind it matter specifically for mesothelioma patients. To begin, ERAS was first developed for colorectal surgery in the late 1990s by surgeons who asked a deceptively simple question. If we apply the same evidence-based thinking to surgical recovery that we apply to surgery itself, can we do better for patients? The answer was a resounding yes. Outcomes improved dramatically, shorter hospital stays, fewer complications, faster return to function, and the framework has since been adapted for urological procedures, abdominal surgery, and thoracic surgery, including for the complex operations used to treat mesothelioma. A meta-analysis of 38 studies on ERAS pathways in surgery confirmed that it consistently reduces both hospital length of stay and post-operative complication rates across surgical specialties. That's not trivial. That's a well-established body of evidence. Now, what makes ERAS different from traditional surgical care is that it begins weeks before the day of surgery. The preoperative phase centers on something called prehabilitation, which is actively preparing the patient's body before the operation so that it goes into surgery in the best possible condition. For mesothelioma patients, prehabilitation typically involves a structured exercise program designed to build cardiovascular fitness and muscle strength. The research is consistent. Patients who are physically stronger going into major thoracic surgery experience fewer post-operative complications, and they recover more quickly. Even a few weeks of guided, targeted exercise before surgery can make a real difference to how you feel coming out the other side. Because mesothelioma surgery is planned rather than emergency surgery, there's usually time to do this preparation, and I would encourage every patient to ask their surgical team about it explicitly. Nutritional assessment and optimization is another preoperative priority in ERAS's programs. Patients who arrive at surgery malnourished or anemic have consistently worse outcomes, and ERAS protocols intervene proactively with dietary guidance, supplementation where indicated, and treatment of anemia before the operation rather than scrambling to address it afterward. And patient education is formally built into the ERAS framework, not as an afterthought, but as a deliberate component of care. Studies show consistently that patients who clearly understand what to expect before, during, and after surgery experience less anxiety, require less pain medication, and reach their recovery milestones faster. Information is genuinely therapeutic. Now, I'm going to take a break here and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, Send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, when it comes to applying ERAS in the operating room, the protocol continues to guide care in ways patients may not see, but that significantly affect how they feel in the days that follow. Surgeons working within an ERAS framework use minimally invasive techniques wherever safely possible. They work closely with anesthesiologists to minimize the body's physiological stress response to the procedure, and one of the most meaningful intraoperative elements is multimodal analgesia. That's a combination of pain control approaches that reduces or eliminates the need for high-dose opioid medications. This matters enormously for recovery. Opioids are effective at managing pain, but they carry significant side effects that directly slow the recovery process. They suppress gut function and they delay the return of normal digestion and appetite. They cause sedation that makes early mobilization harder. And in higher doses, they can impair respiratory function, which is a particularly serious concern after major chest surgery. By combining regional nerve blocks with anti-inflammatory medications and other targeted analgesic approaches, ERAS programs allow patients to wake up from surgery with their pain genuinely well controlled while sidestepping many of those recovery-slowing opioid effects. In the postoperative period, and this is where ERAS most visibly breaks from what most people picture as surgical recovery, patients are encouraged to sit up, stand, and begin walking as early as safely possible after surgery. Sometimes that means the first day after the operation. I know that can be surprising and sound maybe alarming, but working toward early mobilization after thoracic surgery has strong evidence behind it. It reduces the risk of blood clots, reduces the risk of pneumonia, prevents muscle weakness that can set in quickly in bed rest, and is one of the key factors associated with shorter hospital stays and better recovery. Chest tubes and urinary catheters are removed as early as safely possible, which reduces discomfort and infection risk. Early return to oral nutrition, which means actually eating and drinking rather than being kept without food, is prioritized, which replaces the older practice of extended postoperative fasting that many of us remember from or associate with major surgery. Studies of patients in thoracic ERAS programs have found that they achieve lower pain scores, reach their recovery milestones faster, and go home sooner than patients managed under conventional care. And crucially, without any increase in readmission rates. They're not going home too early. They're genuinely recovering faster. For mesothelioma patients specifically, the surgery is already a major undertaking. The body's reserves may have been affected by prior treatment, and what comes after surgery often includes further treatment. Anything that reduces the overall burden of recovery genuinely matters. If you're preparing for mesothelioma surgery, please ask your surgical center directly whether they use an ERAS or enhanced recovery protocol for thoracic surgery. Ask what prehabilitation looks like for patients having PD, who coordinates pain management, and whether you'll be receiving opioid-sparing analgesia. If a formal ERAS program isn't offered at your center, ask whether a physical therapist can guide you through preoperative conditioning on your own. The principles matter, even when the formal protocol isn't in place. To review, ERAS is a structured, evidence-based approach to surgical care that begins before the operation and continues through recovery, encompassing prehabilitation, nutritional optimization, patient education, opioid-sparing pain management, and early postoperative mobilization. And the evidence shows consistently that it reduces complications and helps patients recover faster. You can visit mesothelioma.net for more resources on mesothelioma surgery and finding specialized treatment centers, or call us at 1-800-692-8608 or use the live chat feature to work directly with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.